When treating telangiectasias in a skin type 2-3 like this, sometimes you see the telangiectasia disappearing immediately after passing with this 532 nanometer laser, but you see a darker shade taking the place of the telangiectasia. This is due to the melanin denaturation. No other skin change whatsoever should be seen during treatment. Our clinical endpoint is disappearance of the telangiectasia. Sometimes we have a little erythema left around it. Of course, near the nose, the treatment can be more painful, but it should be always tolerable without any kind of anesthesia, as you see here. When treating hemangiomas like this, we divide the treatment into two stages. The first stage is photocoagulation. It should be done in a very soft way in order to avoid the need for anesthesia. If you treat it slowly in the first few seconds, you can then work much faster, as you see here, because the lesion is not sensitive anymore. And from coagulation you go into an ablative phase, because you can make the whole lesion disappear immediately. Of course, the laser is a vascular laser. It has a good coagulative action, and the whole treatment is performed under perfect hemostasis. At this stage you can work very fast in a quasi-continuous fashion, and here you see the immediate result. This is another treatment of facial telangiectasias. At the beginning, the treatment is shown in a slower way, as you should do the first times you use this kind of laser. The treatment is perfectly tolerable, and right now you see that only about 2/3 of the power that this machine can give you are used. If you slow down, the patient feels absolutely no pain. Sometimes you're allowed by patient tolerability to speed up your treatment. You can either start from the smaller or from the bigger vessel. It makes absolutely no difference. And your endpoint is seeing the telangiectasia disappearing without any secondary skin changes. The skin should not change its color. Another advantage is that, as you see, if I see hyperpigmentations around, without even changing the settings of the laser, I can just treat them, paint them over, and make them look darker than they were before treatment. More telangiectasias can be treated all around the face without changing the settings. Of course, as you get closer to the nose, it's going to be more painful. You should always keep the laser at 90 degrees over the skin. However, right now, for didactic purposes, the laser is being held obliquely. With a little bit of experience, you can get away with it, but you shouldn't use it this way. This is the right way to hold it, perpendicular to the skin. The hyperpigmentation became darker, and now we go on in cleaning the other cheek. The treatment is shown in real time. And this is the telangiectasias disappearing. You actually bring the blood containing them to a boiling point without damaging the surrounding skin. That's why they disappear immediately. There's no purpura involved. Since the skin is left intact, patients who wish can use makeup immediately after the treatment. Treating this seborrheic keratosis is quite easy. The first stage is to make it turn darker and gray. The next phase will be the ablative way. And you see that you can speed up the treatment, all this without any kind of anesthesia, because the first stage, when the lesion turns to gray, is perfectly tolerable, and you start the ablation only after the necrosis of the lesion, when obviously the feeling is not there anymore. And this slow ablation goes on, and it's obviously more aggressive than in other cases. However, as you'll see soon, without changing a lot, we can go into a continuous wave mode, which turns the laser into a good imitation of a CO2 laser, a good ablative laser with coagulative properties. There's absolutely no bleeding. There's also a little intradermal nevus of the upper lip that we can treat, respecting the same order of stages. The first stage, we turn it into gray. This is the photocoagulation of the tissue. And then, since there are small foci of absorption due to the hair, we can use them and heat up more fast. With the same laser, we can also treat very nicely the telangiectasias on the nose and make them disappear as we go over them. Now, if we adjust the speed of movement of our hand, we can sometimes use the same settings for both vascular non-ablative treatments and ablative treatment of some pigmented lesions. All treatments, as you see, are being performed without any kind of anesthesia. Treatment of senile stains, as you see on this dorsum of a hand, is very simple. You have to paint the whole lesion with either a scanner or a 0.5 millimeter or 1 millimeter spot, and you don't need the whole power of the machine. According to the speed of your movement, you can also use a much lower setting, thus diminishing the pain sensation. And here you see that all the treated lesions are much darker than the untreated ones. The pain should be tolerable. If the patient reports an intolerable pain, it means that your settings are too high for this case and you should lower them. You shouldn't be worried in such a case from the smoke. It comes from burning of the hair shafts. That, of course, is of no consequence. Under polarized light magnification, you should be able to see the darker color of the treated hand. You can also treat the same lesions with a scanner. The selectivity of this wavelength is going to cause no consequence to the normal chromic skin, and it's going to turn the stains into a darker color. They'll eventually shed off after 2 weeks. You should not overlap with your pulses because this might cause a burn. Treating the whole dorsum of a hand usually takes less than 1 minute or maybe less than 2 minutes in less experienced hands. And you're going to see soon the final result immediately after treatment. The skin is intact, hands can be washed, and there's no downtime. You see the skin is the same and the stains are darker. In case of these flat keratosis on the hand, we have to be slightly more aggressive than on simple senile stains. We also have to cause a thermal necrosis of the stratum corneum and some very superficial layers of the epidermis. So we do not stop just after darkening of the lesions. We also want to see this kind of grayish discoloration, as you see now. This means that we have burned most of the thickness of this keratosis. So actually the only difference between the treatment of this and a normal stain is just that we insist a little bit more on the lesions to a different clinical endpoint. But the handiness of this machine allows us not to play with the settings too often. Playing with the settings is actually not really disturbing because we don't have to calibrate or we don't have to put the laser in standby. We just keep altering the parameters in real time. And this is the final result. As soon as you get more experienced, you can speed up your work. You can work this way, and if you're fast enough, you avoid any kind of necrosis. The smoke here comes only from hair shafts. You should just not indulge in resting too long on one lesion, otherwise, instead of a darkening of the stain, you'll see a grayish discoloration. That means skin necrosis. The stain will be gone, but the downtime after treatment will be much longer. It's very easy to paint the whole dorsum of the hand in one session, and the treatment that you are watching is going to give you at least an 80% clearance of the stains. Of course, in any other way of treatment, you're going to get either less efficacy or more pain, more downtime. I remind you that at the end, as you see here, the skin is perfectly intact, the stains are darker and will shed off in about 2 weeks. You're watching a large keratosis of the cheek. This lesion is mixed. In some areas it has a thick stratum corneum that is going to be removed. In other areas, like the one treated right now at the beginning, most of the defect is a hyperpigmentation that is treated just like the other stains. By painting over the stain and making it look darker, this is our clinical endpoint. As soon as it gets thicker, we also want to get some gray.